Why are non-convulsive status epilepticus symptoms often missed? Imagine a condition where the signs are so subtle that even experienced doctors might overlook them. Non-convulsive status epilepticus is one such condition. Unlike the dramatic seizures with shaking and jerking, this form of seizure activity quietly persists in the brain, making it tricky to spot. The main reason it often goes unnoticed is because it doesn't produce the typical convulsive movements that grab attention. Instead, it shows up as subtle changes in a person's mental state or behavior, which can be mistaken for other issues. People with non-convulsive status epilepticus might seem confused, drowsy, or less responsive than usual. They could have slight blinking, facial twitching, or repetitive movements called automatisms. Sometimes they might speak less or not at all, or even act strangely, like hallucinating or behaving bizarrely. Because these signs are so mild or nonspecific, they can easily be confused with psychiatric problems, delirium, or even effects of medication or metabolic issues. Another big challenge is that without the dramatic shaking or jerking, doctors might not immediately think of seizures. The absence of obvious motor signs means clinicians often consider other causes first. The symptoms overlap with many other conditions like infections, strokes, drug reactions, or metabolic imbalances, which makes diagnosis even more complicated. Confirming non-convulsive status epilepticus requires a special test called an electroencephalogram, or EEG. This test records brain activity and can reveal ongoing seizure activity that isn't visible on the outside. But in emergency rooms or busy hospitals, EEGs are not always available right away. If doctors don't think to order one, the condition can be missed. Lack of awareness and training about this form of epilepsy also plays a role. Many healthcare providers are more familiar with convulsive seizures and might not recognize the subtle signs of non-convulsive status epilepticus. This can lead to delays in diagnosis and treatment. It's also easy to confuse this condition with the post-seizure state, called the postictal period, which happens after a convulsive seizure and can involve confusion or drowsiness. But in non-convulsive status epilepticus, the altered mental state persists beyond the usual recovery time. Patients in intensive care units or those with brain injuries are especially vulnerable. Since altered mental status is common in these settings, doctors might attribute symptoms to other causes like infections or medication effects, making the diagnosis even more difficult. In summary, because non-convulsive status epilepticus presents with subtle, often ambiguous signs, it's frequently missed. Recognizing it early is crucial because ongoing seizure activity can damage the brain. If someone has unexplained confusion, decreased responsiveness, or strange behaviors, especially if they have a history of seizures or brain injury, healthcare providers should consider this diagnosis. Prompt EEG testing can help confirm it and guide treatment. Always consult a medical professional for personalized advice, and remember that awareness and timely diagnosis can make a big difference in outcomes.